series. The following program contains audio excerpts from interviews with Doctors David Henry, Patricia Ann Ford, Lena Napolitano, and Arya Shander. These excerpts are part of a CME-CE activity entitled Anemia Management and Blood Conservation in the Hospital Setting. To access the entire program, including slides, and to complete the CME-CE post-test, please go online to www.peerviewpress.com/R324. Additionally, please view the PDF file that is part of this podcast feed for complete CME-CE information. This CME-CE activity is supported by an educational grant from OrthoBiotech Incorporated. Approximately 14 million units of blood products are collected and transfused each year in the United States. Dr. David Henry stresses the judicious use of red blood cell transfusion on the basis of recognized guidelines and recently available clinical trial data. The American Red Cross provides clinical and laboratory guidelines for red blood cell transfusion. Dr. Henry explains.
Symptomatic chronic anemia in normal volemic patients, if pharmacologic therapy is not effective or available, Red Cross suggests this would be around a hemoglobin of 8 in the average person, or in a younger, healthier person, 6. Second indication would be prophylactic transfusion to prevent morbidity from anemia in patients at greater risk of tissue hypoxia, and these are patients with cardiac or pulmonary or cerebrovascular disease who may be symptomatic under 10 hemoglobin. The third indication is active bleeding with signs and symptoms of hypovolemia, unresponsive to crystalloid or colloid. A fourth is preoperative anemia less than 9 in impending major blood loss, and sickle cell disease when general anesthesia is anticipated, signs and symptoms of anemia are present, exchange transfusion, pregnancy. Finally, anemia due to renal failure, hemodialysis refractory to erythropoietin therapy.
The American Red Cross guidelines also stress that red blood cells should not be transfused for volume expansion alone or to enhance wound healing. There are limitations of red blood cell transfusion and particularly the transfusion of stored red cells. Yet most patients who undergo transfusion in the intensive care setting receive red blood cells that are up to 3 weeks old.
As the red cell ages, it gets a little tougher and stiffer and harder to get through the blood vessels, and so the exchange is decreased. You don't get as much bang for the buck for older red cells.
It is notable that stored red blood cells take up oxygen but do not efficiently release it to tissues. Dr. Henry indicates that stored red cells carry another important limitation.
The older the bag of blood, potentially the greater the cytokine storm that might come out of that unit of blood transfused. It's a biologic product, and while it's not spoiling, so to speak, which is one risk that a bag of blood can get infected, this is not infection, but rather just inflammatory mediators that seem to generate in the stored unit of blood and may cause the patient a greater reaction when received.
Despite the extensive history and prevalence of red blood cell transfusion, only one large randomized trial to date has assessed the effects of liberal or restrictive transfusion practices in adult ICU patients. In this study by Hébert and colleagues, liberal transfusion was administered when a patient's hemoglobin dropped to 10 grams per deciliter or less. A restrictive policy was defined by transfusion at a hemoglobin value of 7 grams per deciliter or less.
I think the purpose of the study was to visit the intensive care unit where transfusion rates are higher in these sicker people. And in his incredible analysis of patients who had a liberal or restrictive transfusion policy, he looked at those patients who were on mechanical ventilation, which was a significant proportion of his patient population studied, and asked the question, do they do better, get off ventilators faster if you use the liberal transfusion policy or the restrictive transfusion policy? And surprised us all, it didn't make a difference. So you were just as likely to get off the ventilator at a restrictive as opposed to a liberal transfusion policy.
In addition, Dr. Henry notes that in a subgroup analysis of more than 300 patients with known coronary artery disease, patients assigned to a liberal transfusion practice experienced a higher rate of multisystem organ failure, possibly owing to limited critical oxygen delivery. A similar trial in pediatric patients was conducted by Lacroix and colleagues. In this recently published study, transfusion was defined as liberal when the hemoglobin level dropped below 9.5 grams per deciliter. A restrictive policy required transfusion when the hemoglobin value was less than 7 grams per deciliter.
Here are these desperately ill children in pediatric intensive care units similarly to the adult study we discussed for a liberal or restrictive transfusion policy, and they found in such a study that letting the children get as low as 7 gram percent hemoglobin didn't have a worse change in morbidity and mortality, and of course led to much fewer transfusions.
Both the adult and pediatric transfusion studies demonstrate that more frequent transfusions, which are intended to avert the detrimental consequences of hemoglobin levels below 10 grams per deciliter, do not lead to better outcomes for critically ill patients.
What we've discussed is that for so long we have focused on a number, a hemoglobin number, around which we worry that transfusions are necessary at a particular number, and this has led to a certain transfusion rate in ill people. Thanks to very aggressive and novel studies by talented investigators, restrictive transfusion policies allowing hemoglobins to float as low as 7 in this adult or pediatric population, the transfusion requirements are markedly less. Of course, if you let the hemoglobins go down, the outcomes are no different in those adult or pediatric populations when you have this restrictive transfusion policy.
This has been a CME CE certified activity jointly sponsored by PVI, Amedco LLC, and the University of Florida College